Okay, so we're here with our first ever guest on the first ever episode of the Tokyo Living podcast, Dr. Tom Lomax. Tom, welcome to the show.
Hi, thanks for having me.
So many of our listeners will be familiar with you, and for some, you may in fact be their family physician. For those that aren't, perhaps if you can just provide a brief summary of the Tom Lomax story, your career history, and what brought you to Japan.
So I'm a UK trained GP, but I actually first came to Japan before I did my GP training. I was out here, not in Tokyo, I was up north. I lived in Yamagata in Tohoku, up north of Japan, for a couple of years before I went to medical school. I did my first degree in biochemistry. I graduated from that in '93, and I had a place to go to med school. But I wanted to do something else. I wanted to take a bit of a break from continuous study. So I got a job teaching English. I spent 2 years in rural Japan. I guess I picked up some reasonable Japanese, and I maintained my interest in Japan, because after that I went back. I went to medical school in London, and I finally qualified as a doctor in 2000. And then I just worked in the UK public health system, mostly in hospital medicine. I did training in surgery and in emergency medicine. And then, my sort of life priorities changed a bit. I had kids, and I decided to go into family medicine, into general practice. I finally qualified as a GP in 2008. And when I was looking for jobs, because I'd maintained some of my connections in Japan, I had a sort of speculative look at job opportunities in Tokyo, and just sort of, I guess, coincidentally, just as I was finishing my GP training, Tokyo Medical and Surgical, which is where I work now, were advertising that they wanted to employ a UK trained GP with surgical experience and training who had some interest in Japan. And I thought, well, that is a pretty narrow remit. That's a pretty specific description, and perhaps I'm the only person who actually checks all those boxes.
Yeah.
So I contacted the practice, and I think I was quite a good fit for what they were looking for, and I was quite interested in coming out to Japan. So initially, I came out in 2008 with my family. My wife's Japanese, so it shouldn't take too much convincing to persuade her to come out here. And we were initially going to spend 2 years in Tokyo, but the job seemed to work out well, and we all settled in. And we like living here, so that was 12 years ago now. Things have moved on a little bit. I'm now one of the partners in the practice. I'd like to think that I've helped it develop and grow over the last few years, and I'd like to think that I've become sort of a part of the wider community, the foreign community in Tokyo. So I guess that's a brief summary. Yeah.
Absolutely. And when you went back to the UK after being out here in the 90s, did you always have that vision of once you started medical school of coming back and practicing medicine in Japan, or
no, I didn't,
did it just come up later?
No, I mean, I sort of very much assumed that my career would stay in the UK, and it didn't really occur to me until, it was almost on a whim that I decided to look at medical jobs in Japan, because I think you invest quite a lot in a medical career, and most medical careers are quite sort of linear. You sort of progress on to the next stage. So making a big sort of sideways move, sort of jumping out and doing something completely different in a new country, I think for a lot of doctors seems a little bit risky, and particularly when I'd sort of looked into it, it turned out that getting a medical license to practice as a foreign doctor in Japan was quite laborious. It took about a year of applications and study and exams and so on. So no, it was a bit of a sort of sideways move, and not something I'd worked towards over the long term.
Yeah, interesting. So as far as this podcast goes, we're hoping to get you on, a few times over the journey, and get you to speak on a number of different topics. I thought an appropriate one at this time of the year would be to talk about Kafunsho. And we discussed this briefly at the start of last week. And since then, I've had at least 2 or 3 patients come in starting to complain of these sort of symptoms. So I think it'd be a good topic to speak about.
Yeah.
We might just go back to the basics of allergies to start with. Now, personally, I have what's been described as a mild intolerance of pineapple. I have a strange phobia of birds and fish, and I have quite a strong aversion towards parking attendants. But as far as allergies go, I've never actually had an allergy. So perhaps just in simple medical terms, what actually is an allergy and what makes an individual allergic to something that another person isn't?
I mean, I guess at sort of simplest level, allergies are inappropriate triggering of the immune response. So, I mean, obviously, our immune system is there to defend us from pathogens. So, if we get infected by a parasite, a virus, a bacteria, we need a system that recognizes that and tries to kill it. And that's basically by recruiting white cells and triggering an inflammatory response. But sometimes our immune system can sort of get things wrong and can identify something as an attacker when it isn't. It's just part of the environment. So, I mean, probably house dust is the best example. That's probably the most common allergy in the modern world. So that's basically, I mean, when we say house dust, I sort of say to people, you've got a dust allergy. And they'll sort of say something like, oh, yeah, there's a lot of building work going on. But I mean, house dust is quite specific. So the proteins that are found in dust mite feces, so dust mites live in, the tiny little bugs that live in, any sort of soft furnishings, carpets, sofas, beddings, and their diet is human skin cells. So when we shed skin cells, dust mites eat them. And then, like every other living thing, they defecate. And the accumulation of dust, so if you take your carpet outside and sort of hit it, that big cloud of stuff that comes off, I mean, that's a mixture of sort of dead dust mites, dead skin cells, but quite a lot of it is dust mite feces, fecal matter. And in quite a lot of people, your immune system will decide that that's something that it needs to attack, and that will trigger an immune response. So that means if you inhale a bunch of house dust, your nasal mucosa, the lining of your nose, will basically decide that it's being attacked, or your body's being attacked. And the first and simplest thing you do is release histamine. So histamine is an inflammatory chemical that in your skin will make it turn red. So if you see someone getting hives, that's histamine release. If your eyes start tearing up, that's histamine release. If you get a blocked or runny nose, that's histamine release. So it's inappropriate release of histamine because your immune system has decided something's foreign, or rather, a foreign material is an attacker.
Yeah, interesting. I think I'm going to try to go to sleep whilst holding my breath tonight. That's a pretty disgusting thought.
Get a new pillow.
Yeah. Terrific. Okay, so that's a really good summary. Going on then to Kafunsho, why do people suffer this in particular in Japan?
Yeah. So, I mean, pollen allergies obviously aren't unique to Japan. And I mean, in different parts of the world, you'll get peaks of pollen. And it's not so much the total quantity of pollen, it's whether it's a single type of pollen in abundance. So in a lot of countries, there's a big peak of grass pollen in the summer. So it's one type of pollen that all looks the same. And that has much more potential to generate an inappropriate immune response to, form an allergy than a whole kind of plethora of different pollens. So particularly in Japan, this is a problem because there's a massive abundance of a single type of pollen right about this time of year. So while there are other allergy seasons, and you'll see people who've got different kinds of pollen allergies getting triggered at different times of the year. So for example, I mean, basically the broad sequence goes, the biggest and most severe pollen allergy is the early spring Japanese cedar pollen, the sugi. So that's kind of from about now through to early April. And that's when you see the most advertising for hay fever medications on Japanese media, on the subway, on the TV. Then you get sort of smaller pollen seasons. You get broadleaf tree pollens, which are kind of mid-spring, and then you get grass pollens, which are through the summer, which you pretty well get anywhere else in the world. Actually, most countries there'll be some grass pollens in the summer, and then there are some autumn pollens as well. I think ragweed is the main autumn pollen in Japan. So that's the kind of sequence of pollens being released. But the sugi, the Japanese cedar pollen season, is kind of uniquely bad. And it's not a natural phenomenon. It's basically a man-made thing. And that's because after World War II, when Japan was kind of economically on its back and the government wanted to kind of restart the economy, get people back to work, but also provide a lot of construction materials, they very reasonably decided the best thing to do for that would be to invest heavily in forestry. So forestry in Japan means those sugi, Japanese cedar trees, which historically were used to build everything that's made out of wood. So, I mean, when Japan was basically bombed flat in World War II, and people were looking around saying, we're going to need some materials to rebuild all this, they thought, okay, well, let's go and plant an abundance of cedar trees, which was fine at the time. I mean, it probably did help get people back to work and restart the economy. But sort of fast forward to the 1970s, the Japanese construction industry found that it was cheaper and better to build wooden buildings in Japan using imported Canadian timber, which is mostly what's used now. So most of the cedar forestry businesses went bust, went bankrupt. So, I mean, they essentially replaced the native mixed deciduous with some, native cedar cover with, across about 50% of the country, just a monoculture of cedar trees. So you go out into the countryside and lots of places you go to, it's all the same tree. It's that big, tall, straight tree with those dark green leaves. That's the sugi tree. I mean, they really are everywhere. And when they pollinate, they produce an absolute stack of pollen. And that's because they're not flowering trees. So a lot of people, when they start to get allergy symptoms, they'll look around them and they'll sort of see something flowering. So commonly people will say, yeah, I'm seeing a lot of cherry trees in blossom, and now I've got allergic symptoms. I'm allergic to the cherry tree blossom. Right, yeah. And that's not the case. So if flowering trees make very, very small quantities of pollen, and they rely on insects to transfer the pollen from flower to flower. So they don't produce enough pollen to saturate the air to generate allergic symptoms. Cedar trees and other wind pollinators, they don't use insects. There's no insects flying around the cedar trees transferring the pollen. They just produce a massive quantity of pollen, just enough to kind of fill the air. And that's how they pollinate, just by, generating a huge abundance of pollen. And that pollen can blow hundreds of kilometers. So you might be in the middle of Tokyo and you'd look around and go, well, there's no trees here. How can I possibly be suffering an allergic reaction to a cedar tree when I haven't seen one for like months? But the pollen is blowing in from the surrounding prefectures. It's blowing in over very long distances. And of course, when you're in the countryside, if pollens blow onto the ground kind of absorbs pollen. It's wet and sticky. But when you look at cities, most of the surfaces are effectively reflective to pollens. So if everything is grass or a glass or concrete, pollen can't stick to that. So it just continues to blow around until it finds something moist that it will stick to, which is, particularly something like your eyes or your nose. Yeah. So that's the particular issue for Japan.
And then the other thing that we often hear people say is that they may not suffer these symptoms for the first few years in Japan, or even 10 years in Japan. Yeah. But then it starts to come on. I'm sure there's some conspiracy theorists out there that think that the government put something in the water when you arrive in immigration, and suddenly after 5 years, in addition to the tax system changing, you also get this triggering of hay fever. Do we know why that comes on?
Yeah, I mean, that's immune sensitization. So I think a lot of people have this concept that you're like born with allergies, that you're intrinsically allergic to some things, but that's not the way allergies work. So your immune system's got to see something. And quite often your immune system is seeing something over an extended period of time. And along the way, it decides it doesn't like it and it's an invader. So if you look at Japanese people who've been born and grown up in Japan, about 25% of them are allergic to cedar pollen. It's extremely common. And, you know, some people mildly and some people very severe. If you looked at foreigners who just got to Japan in their first season, it would be vanishingly rare to have a cedar pollen allergy in your first season, the first February and March you're in Japan.
Right.
But with each extra year you spend in Japan, your risk of sensitizing, your risk of your immune system getting inappropriately triggered goes up. So, I mean, if I look at my own family, I've got a sort of mild to moderate cedar pollen allergy. And my two kids were one of whom sneezing in the background, actually. She's got
well timed.
So just before this call, I was trying to get her to put an air purifier in her room. The first 5 years we were here, no one had any problems at all. We were laughing. And then in year 6, my youngest daughter started to get cedar pollen allergy. And I think she sort of progressively got worse each year. So year 7 was worse than year 6. And then it sort of plateaued at about 9 or 10 years in. So there's that sensitization period, and then your allergic symptoms get worse. And then if you're lucky, you'll turn the corner and you'll start to desensitize. But that's variable and there's no guarantee. So my middle daughter started to sensitize a bit later. And I think at the moment, she's the one who has the worst allergic symptoms.
Really?
And I'm hoping that she'll desensitize in the next few years. But at the moment, not much sign.
Yeah, right.
But that's a sort of typical ballpark. I tell people, if you get allergic symptoms from Japanese cedar in the first 5 years, you're unlucky. If you're going to sensitize, it's going to happen between years 5 and 10. If you've been here 10 years and you've got no symptoms whatsoever, pretty likely that it's just never going to happen.
Fantastic. Sounds good to me. I'm year 16 now, or year 17 now, so yeah. Fingers crossed. Great. So going on then to treatment, and I guess another thing that'd be interesting to know is with more people and especially more foreigners wearing masks this season, and even last season it probably didn't start as much, but well, I guess last season, did you notice any sort of trend in decrease in the number of people seeking treatment? And
last season was very difficult because it was extremely atypical. Yeah. So last year we hit the pollen, I think probably February. So I start to see cedar pollen allergies again, the other thing to say is that the season's got a bit earlier because of global warming. It's much warmer in the winters now than it was 20 years ago. So the whole season has sort of shifted maybe like 10 days earlier. So last year, during February, COVID was really still just something that was happening somewhere else, and it was on the news, but it wasn't here. Yeah. So I think I probably saw a normal number of people with allergic symptoms. And then in March, I'm sure there were I'm sure there were people having allergic symptoms. I don't know how many, but everyone was staying away from the hospital. So, we weren't seeing people unless they're absolutely at death's door. So I just don't know what the proportion of people who were affected last year was, whether it was up or down. But what I saw at the clinic was a lot less. And I think I'm seeing the same a bit this year, actually. I think people are sort of, by and large, staying away. But I am seeing some people who are getting acute onset respiratory symptoms. And sometimes it's really hard to say, is it COVID or is it a respiratory virus or is it allergic symptoms, because the symptoms overlap so much. So I had one person who I tested for COVID today, and I said, I think it's probably allergies, but I'm going to test you for COVID anyway. Yeah.
Yeah. Well, I guess short term, it's probably a better outcome, but
yeah. So I think you said the masks, and I think probably the masks do help a little bit, and maybe they are cutting down on symptoms, but it's hard to say.
Are there any other sort of conservative measures that people can take to minimise the effect?
Yeah, you definitely are more exposed outside. I always know when I'm going to get a lot of allergy consultations at work, because I cycle into work, and the first place I feel it is in my eyes. So if I start tearing within 10 minutes of leaving the house, I know the allergy season started.
Yeah.
That's a really good and really sort of sensitive way of telling if it's an allergic symptom. If the first thing that starts to react is your eyes, if you get gritty, itchy eyes and you start to tear, and then you get nose and throat symptoms, by and large, that's a pollen allergy. Yeah, you can, if you go out, you can minimize your time outside. You can wear goggles or glasses. They're probably partially effective.
Yeah.
And you put a mask will help as well. And be aware that clothes can attract quite a lot of pollen as well. So if you sort of take care not to wander around with your outside, if you wear a jacket and you take it off as soon as you come in the house, that will probably remove some of the pollen load it's carrying. And if you dry your clothes outside, they'll probably trap quite a lot of pollen as well.
Then, yeah, pharmacological intervention. Obviously, if someone is really suffering, they should obviously go and see a medical professional about that. What are the things that are most commonly prescribed?
Yeah, I mean, there's probably quite a lot. There's a few things you can do if you've got mild symptoms before you go and see the doctor. I guess in the foreign community, because people aren't familiar with the range of over-the-counter medications, a lot of people go to the pharmacy and, it's all labeled in Japanese. If they can't read it, then they sort of often will just give up and go and seek medical advice. But you can get perfectly decent strength antihistamines over the counter here without a prescription. You can get chlorpheniramine, which is Piriton, which is quite an old school antihistamine. You can get that without a prescription, but it is quite sedating. So, I mean, some people even take it as a sleep aid. If you take chlorpheniramine 4 milligrams, which you can just go and buy in a pharmacy during the day, most people will feel quite drowsy, actually. So I'm always a bit hesitant to recommend that. And until about 5 years ago, most of the modern non-sedating antihistamines that we used to, that you just go and buy over the counter in the US or in Europe, you could only get on prescription in Japan. But as of 5 years ago, they decided to put fexofenadine, which is Allegra, that you can buy in a Japanese pharmacy without a prescription. And that would be my first choice. So if you sort of said, what should I go and buy? I'd say just go and buy some Allegra, 1 tablet twice a day. For people with mild symptoms, that's often all they need.
Yeah. Okay. Terrific. Well, I think that's a lot of great information there. Is there anything else in relation to this condition you think is worth mentioning?
Yeah, I mean, it can get really bad. So I said sort of if you've got mild symptoms, then you can try to do limit your exposure by controlling your environment. You can put an air filter in your room, for example. As I said, I was doing that with my daughter. That definitely helps a bit. If you can buy ones that's specifically designed to filter out pollen, you can buy over-the-counter medications. But there are a proportion of people who've got quite bad symptoms, and there are sort of an escalating number of treatments that we can offer that I can prescribe. So I guess just sort of running through those briefly. I'll sometimes prescribe people stronger decongestant antihistamines, medications with pseudoephedrine in them. Those are a bit more powerful. I give quite a lot of people steroid nasal sprays. I use them myself. Those are helpful. And then kind of moving up the ladder, I've got a sort of small cohort of patients who I give depot steroid shots to. So if people are really bad, they can just come in and have a single injection of a relatively high dose of steroid that will just be released gradually into their body over about 3 or 4 weeks. And if you can't keep doing that through the year because the steroid's not good for you, but if you just need like 1 shot to get you through that really bad month, it's actually super helpful. And then finally, there's a new injection that came out a couple of years ago. I think it's called Xolair, which is actually a biological drug. It's very, very expensive, but basically it binds and clears all of the IgE antibodies, which are the antibody class that cause these reactions. It just basically clears them out of your system. So that is an amazingly powerful, amazingly effective injection. but it only works again for 2 to 4 weeks. You can keep repeating it, but it's super, super expensive. Although, because pollen allergy is such an issue in Japan, it actually is covered by Japanese health insurance.
Right.
I mean, even with the Japanese health insurance, I think you're still looking at like a few $100s a shot.
Yeah,
But if people are really bad, it can keep them going through a bad time.
Yeah.
There are plenty of prescription drug treatments. Sort of there's a whole spectrum. And usually if I'm seeing people who've got allergy symptoms, I'll kind of work up the ladder until we get their symptoms controlled.
Right. That's terrific. Okay, well, like I said, we're going to get you on in the future to speak about some other topics. In the meantime, where can people find you? If you can just give some brief details regarding the clinic, where you're located.
Yeah, sure. So we're directly opposite Tokyo Tower. So my office is Tokyo Medical and Surgical Clinic. The office has been running since the 1950s. It's I think just about hitting its 70th anniversary. We've been through like 4 generations of foreign doctors, and we're, as I said, we're located directly opposite Tokyo Tower, 32 Shiba-koen building, and we're on the 2nd floor.
Yeah, and you basically offer every type of medical service that one would need.
No, I mean we're an outpatient facility, but we're sort of basically at the core we're a family medicine service. So we should be able to deal with most outpatient medical problems, but we've got specialists who come in. We've got dermatology, gynecology. We've got a whole range of different medical specialists who we bring in. We've got minor surgery, and we've got a good referral network, so we can send people to hospitals as well if we need to.
Yeah, terrific. And we'll put the details of the clinic in the show notes as well.
Thanks very much.
All right. Well, thanks very much for coming on. We know you're an extremely busy man, and we really appreciate your time tonight. And look forward to chatting again soon.
Great. Thanks very much.
All right. Thanks, Tom. Take care.
Bye, everyone. Bye-bye.